I chose medicine because I've always been deeply moved by the impact that health-related issues can have on individuals and their families. I specialize in cerebrovascular disorders, particularly with a special interest in inflammatory cerebrovascular conditions, ranging from inflammatory to non-inflammatory conditions, spanning from young adults with cerebral vasculitis to elderly adults with inflammation related to cerebral amyloid angiopathy and other complex cerebrovascular disorders. A typical patient encounter with me usually begins with a comprehensive and empathetic discussion about my patient's symptoms. The patients that I see often present with symptoms ranging from headaches, brain fog, cognitive issues, focal neurological deficits after a stroke. It's very important that we understand the nature of their symptoms, the duration of their symptoms, and the impact that those symptoms are having on their daily lives. I like to ask, what drives them, what they like to do, what hobbies they have, particularly understanding their occupation, because it's important for me to understand the treatments that I'm going to be giving them, whether or not they have to be altered according to their profession, and also whether or not they're going to be able to get back to that type of work. I particularly specialize as a cerebrovascular immunologist, and I'm able to give patients not just a diagnosis about the condition that they have, but we're also able to treat the patient whether or not they have an inflammatory condition that requires immunosuppression and anti-inflammatory medications, or whether or not they have a non-inflammatory condition that requires, for example, surgical procedures. We make sure that all necessary specialists that are needed to be involved in the cerebrovascular care of the patient are part of the team, particularly when needing additional procedures like spinal fluid testing, cerebral angiograms, brain biopsies. These patients, particularly those with immune-mediated conditions, are on medications for years, and although they're in complete remission, they need frequent monitoring. We build lasting relationships with these patients. What I find most rewarding about my job is the profound impact I can have on my patients' lives. The ability to navigate their health journey with them, to be able to give them the right diagnosis, to be able to get them treatments to where they're back to a meaningful quality of life.